businesses and to consumers across the state, and also play a pivotal role in the larger effort to reform our healthcare delivery system to improve quality, improve the health of Oregonians, and significantly reduce costs. Before we signed the bill, I want to just acknowledge some people who were critical in getting us here. The Health Insurance Exchange Board, under the leadership of the Chair, Liz, there you are. Liz Baxter, Vice Chair Terry Andrews. Where's Terry? Is Terry with us? Right here. Terry. Representative Mitch Greenlick, who will speak in a moment, and Senator Montes Anderson, both have been champions of the Health Insurance Exchange over the past year and gave us the ability to get here today. Rocky King, the Executive Director of the Health Insurance Exchange, and Amy Farmer, Deputy Director. Rocky will go down in history as almost single-handedly killing the bill by not stopping his testimony. And finally, the chair of the subcommittee promised to vote the bill out if he would stop. Just kidding. I also want to take a moment to thank the staff of the Health Insurance Exchange and some other staff members. I think it's very fair to say that in many cases, the people who really get things done, who make the biggest contributions, are the folks who are behind the scenes. So I'd like to thank Nora Leibowitz for her courage and for living by the belief that faith is her co-pilot. 2 years ago, she and Barney Spate, which takes a lot of courage in itself, wrote the very first health insurance legislation that created the Health Insurance Exchange. Tris de la Rosa, obviously someone who's not risk adverse. 2 years ago, or a year ago, in June, when we signed the Health Insurance Exchange, not knowing whether she was going to get paid, not knowing whether she was going to have a permanent job, left her job at Salem Hospital, became the first employee of the Health Insurance Exchange, and helped bring up the public corporation. So we definitely want to thank her. Kelly Harms and Lisa Morosky put together the business plan that was actually approved by the legislature in House Bill 4164. So thank you very much. And then there's Carla Messerholt. In every organization, there's somebody that holds it together, that provides the glue, that makes sure that the payroll is met, and that there's a roof over your head, and that the computers work, and the telephone works. And Carla's been doing that for 23 years, almost a quarter of a century, bringing up OMIP, the small business plans that were offered under the Insurance Pool Governing Board, implementing FEOP and the Healthy Kids Connection, and now the Health Insurance Exchange. An individual without whom Oregon would not be at the forefront of national health care reform. So I just want to acknowledge the tremendous work of Carla. Finally, I just personally want to again thank Mike Bonetto and Sean Colmer, who really were the glue inside the building. Without their magic, we wouldn't have gone from a group of 50 or 60 people a year ago to being here today signing the second of two very, very important bills. Thank both of you. I'm just going to say a couple of things, and then we'll turn it over. We have a couple of other speakers. I just want to say that, we've all felt from the beginning that it was very, very important for the state of Oregon to design and implement and operate our health insurance exchange rather than defaulting to the federal government. And I think this exchange is going to provide significant benefits to small businesses, significant benefits to individuals. It's going to give us the ability to compare insurance plans based on quality and cost. It's going to provide assistance in how you use health benefits to actually improve health. It's going to be a resource for this state, and starting in October, I believe that this year, it'll be accessible to Oregonians through an easily accessible website, through a toll-free number, and also through insurance agents and community-based organizations. And it is going to be a central contributor to the success of our larger health care reform effort by setting the standards for plans to ensure that they reduce costs, that they maintain quality, and that everyone has access to the kind of coverage that they need and deserve in this state. So this is just a great day for Oregon. I mean, I'm not sure I would have believed 2 years ago that we'd be standing here all together with these two bills that passed with huge bipartisan votes, and I think is the first step towards really transforming healthcare here in Oregon and hopefully in the United States of America. So let me introduce Representative Mitch Greenland.